Go to the economics editor of The Australian now, Adam Creighton, who's projecting the federal debt is going to go beyond $1 trillion, $1,000 billion by 2022. Adam, I would have thought that's just about a certainty, isn't it?
Yeah, look, I think it is basically, Chris. And if you throw the states in there too, of course, I think it's going to be about $1.5 trillion by 2022. So, look, it's an extraordinary increase in debt. The numbers are so large, it's hard to fathom this is even happening, actually. But it is, of course. And the deterioration that we're focusing on today at the federal level, that $290 billion, of course, that's only over 2 years. The Treasury quite sensibly didn't actually give us any numbers for 23-24 because the level of uncertainty is so high. That makes sense, but nevertheless, they're going to be very bad years too. So it's not just $290 billion. This is going to be a fiscal deterioration for a very long time. And I think the question has to be asked, have we spent too much on this? Yeah,
well, you've been very strong on this, and this is what worries me, because we could have spent all this money yet still find ourselves dealing with the pandemic running virulently in a year from now, 2 years from now.
Look, that's exactly right. That's a worst-case scenario. But, look, it could happen. I mean, as you just said earlier, we are seeing further outbreaks around the world now, and we're seeing them in countries that have had lockdowns, haven't had lockdowns. It's kind of irrelevant. It almost seems like there's no correlation between how the virus behaves and what countries do. So if that's the case, you're right. We could be in that situation. It could spread around the country, and all of this would have just been a big waste, actually.
All of this hinges on medical outcomes, of course, health outcomes. For instance, if there was next month an effective vaccine available across the world and available across Australia, then the way this government has handled it would be first rate, best in the world just about.
That's true.
All that money to get us through it, and then on we go. But we have to plan, don't we, economically for a no-vaccine scenario. And that means that when we get outbreaks like we've got in Victoria, with 0.05% of the population infected at the moment, we can't afford to shut down. The federal government, the state governments, they won't be able to keep shutting down like this because too many people's livelihoods will be crushed.
That's right. No, look, they certainly can't, and I was surprised, frankly, that Victoria did it a second time, because it is just so damaging. If you look at Europe, the French Prime Minister has ruled out further national lockdown. He just said it is just far too damaging. Even if there is a second wave there, it won't be happening. Norway has said the same thing. So I was surprised that Victoria did that. It's good to see New South Wales making the right sounds here. So far, they seem to have implied that there won't be a general lockdown here. I sincerely hope that is the case. But, yeah, look, it just seems far too blunt an instrument when, if you look at the statistics overseas, even in a country like Sweden, say, which didn't lock down, you really see that, that half of the deaths were basically in nursing homes. So surely it makes sense to just target those areas rather than shutting down the whole economy. Yeah,
protect the vulnerable. Well, this is going to emerge as we go on, but in best case scenario that things do work out the way the government is suggesting at the moment, one of the encouraging aspects is that everybody from the Reserve Bank governor down seems to be saying the only way out of this is economic growth.
Yes.
So we might see some economic reforms where we get rid of red tape and green tape and we actually welcome some investment in this country and try and open it up a bit.
Yeah, look, that's right. Of course, that's how we've dealt with huge budget deficits in the past. It's been economic growth. The problem this time, of course, is that the biggest part of that economic growth in Australian history, which, of course, is population growth, won't be there for a number of years. And so it's going to be much, much harder to grow out of this debt. As you suggest, the only way to do it is through clever reforms. But the track record of governments over the past 15 years or so is that there is not much reform. And, look, let's face it, we still haven't really seen that much from this current government at all. So I'm a bit sceptical. I was a bit disappointed today that Josh Frydenberg was a bit vague on the income tax cuts, which he last week seemed to hint would be brought forward, but he didn't really confirm that today.
Well, he's got a budget in October. I suppose he might be holding back for that. Just finally and quickly, if you could, Adam, we talked about the various health approaches in other countries. Compared to other OECD countries, other developed nations, have we spent a lot more than other nations, or has everybody been hit in similar economic terms?
Well, in terms of government spending, we've certainly spent almost the most, I believe. It's an extraordinarily generous package. But on the other hand, we started with far lower debt, and indeed the increase in net debt at the federal level has been a lot lower, actually, than other countries because their economies have been hit so badly. So our net debt's going from about 25% to 35%, whereas across the G20 it's going from 80 to about 102. So it was a lot higher to begin with, and it's increased even more. So we, in some sense, can afford this, but still, we want to hope that it's worth it because it is an enormous splurge.
Adam, thanks for joining us again.
Thanks, Chris.
Adam Creighton there, the economics editor at The Australian.